The hemoflagellates or blood flagellates of humans and animals are members of the group kinetoplasty. They are characterized by the presence of kinetoplasts. Kinetoplasts are complex of abundant circular DNA within a large mitochondria. This can be observed in stain preparations. Two genera that are important in human disease are Leishmania and Trypanosoma. Trypanosoma brucei causes African trypanosomiasis, while Trypanosoma cruzi causes American trypanosomiasis or the Chagas disease. These two are important in their endemic areas. In equatorial Africa, Trypanosoma brucei infect both humans and animals and is transmitted by the bite of tsetse flies of the genus Glossina. Multiplication at the bite site produces a transient chancre, and there are two types of African trypanosomiasis. One is East African trypanosomiasis, which is characterized by a rapidly progressive acute febrile illness with lymphadenopathy. This is caused by Trypanosoma brucei rhodesiense, and this may be fatal even before central nervous system involvement is prominent. The second one is the West African trypanosomiasis, which is caused by Trypanosoma brucei gambiense. And this is responsible for the classic African sleeping sickness. West African trypanosomiasis has a more chronic course that begins with intermittent fever, night sweats, and malaise. Pronounced lymphadenopathy, especially of the posterior cervical lymph nodes, is classic sign. Involvement of the central nervous system becomes prominent with time, somnolence, confusion, and fatigue, leading to stupor, coma, and even eventual death. Treatment of this African trypanosomiasis depends on the stage of the infection and is also potentially toxic. The diagnosis is based on the basis of geographical history and clinical findings. Patients will show high total IgM levels in the blood and CSF. CSF will show pleocytosis with 50 to 500 mononuclear cells per microliter in CSF. So usually doctors will request CSF cell count and differential, and if there is, usually when there is CNS involvement, usually diagnosis is established by demonstrating the parasites and thick and thin films of peripheral blood, buffy coat preparation, or aspirate of the lymph nodes or bone marrow, or even in span CSF that is stained with GIMSA. But most commonly, in the examination for blood parasites, thick and thin smears are examined for the presence of parasites.